So let's unpack that a bit. Inflexible reasoning. What does that actually mean in this context? Otto, you've been neck deep in the deep learning side of things. What's your take on why these models are so rigid?
Well, I think that's a bit harsh. I mean, these models are constantly improving. We're seeing advancements in attention mechanisms, transformers, all sorts of things that are designed to improve reasoning and context awareness. Maybe it's just a matter of scale, more data, bigger models, more sophisticated training techniques.
Okay, so let's drill down into some specific examples. What are some of the most glaring failure modes you've seen in medical QA that highlight this inflexibility?
Okay, I see your point. These are valid concerns. But isn't it possible to address these limitations with better data representation? Could we create more structured data sets that explicitly represent drug interactions, rare disease information, and spatiotemporal relationships? Maybe we just haven't figured out the right way to encode medical knowledge for these models to learn.
It's like trying to create a map of the world by simply listing all the coordinates. You might have all the data, but you wouldn't have a map. You need a system that can understand the relationships between those coordinates, the topology of the land, the flow of rivers. That requires a different kind of representation, a different kind of algorithm.
So, Sarah, you mentioned neuro-symbolic approaches. Can you elaborate on that? How might combining symbolic reasoning with neural networks help address these limitations?
Sure. The basic idea is to combine the strengths of both approaches. Symbolic reasoning provides a way to represent knowledge explicitly, using formal logic, ontologies, and other symbolic structures. This allows the system to reason deductively, to make inferences based on logical rules. Neural networks, on the other hand, excel at pattern recognition and learning from data. By combining these two approaches, we can create a system that can both learn from data and reason logically. Imagine a system that uses a neural network to identify patterns in medical images, but then uses symbolic reasoning to interpret those patterns in the context of the patient's history and other relevant information.
But how would you integrate those two systems? It seems like a huge engineering challenge. And wouldn't the symbolic reasoning part become a bottleneck? I mean, neural networks are so good at parallel processing, while symbolic reasoning tends to be more sequential.
That's a valid concern, and there are certainly challenges to overcome. But there are also a lot of promising research directions. For example, we could use neural networks to learn the rules of symbolic reasoning, or we could use symbolic reasoning to guide the training of neural networks. There are also hybrid architectures that combine neural and symbolic processing in a more tightly integrated way.
I'm intrigued by the idea of using neural networks to learn the rules of symbolic reasoning. That could potentially allow the system to adapt to new situations and learn new reasoning strategies without having to be explicitly programmed. But how would you ensure that the learned rules are valid and consistent? You wouldn't want the system to start making illogical inferences.
That's where the neuroscience comes in for me. What if we could look at how the brain integrates different types of information, how it combines sensory data with prior knowledge to make decisions? Could we map the neural correlates of logical reasoning and use that as a guide for designing neurosymbolic architectures?
That's a fascinating idea, but it seems incredibly complex. We're only just beginning to understand how the brain works. I'm not sure we're ready to translate that knowledge into AI algorithms.
Maybe not, but it's worth exploring. Even a simplified model of brain function could provide valuable insights into how to design more robust and adaptable AI systems. Think about the brain's ability to handle uncertainty and ambiguity. It's constantly making predictions and updating its internal models based on new information. That's something that current LLMs struggle with.
And the brain's ability to translate between different coordinate systems is also remarkable. It can seamlessly integrate visual information with motor commands, spatial maps with temporal sequences. If we could replicate that in AI, we could potentially unlock a whole new level of intelligence.
So, what are some concrete research directions we should be pursuing to address this problem of inflexible reasoning in medical QA?
From a neuroscience perspective, I'd like to see more research on the neural correlates of medical knowledge reasoning. We need to map how different areas of the brain interact during human medical diagnosis. Are there specific neural circuits that are responsible for integrating different types of information, for handling uncertainty, for adapting to novel situations? If we can identify those circuits, we can potentially reverse engineer them and incorporate them into our AI models.
I'd focus on developing better data representation techniques. How can we structure and encode medical knowledge in a way that facilitates more robust and flexible reasoning in LLMs? Maybe we need to develop new ontologies or knowledge graphs that explicitly represent causal relationships and spatiotemporal dependencies. We also need better metrics for evaluating how well a model navigates exceptions, contradictions, and contextual subtleties in medical data. It's not enough to just look at the output. We need to understand the model's internal reasoning process.
I'd like to see more research on neuro-symbolic architectures. How can we combine symbolic reasoning with neural networks in a way that is both efficient and effective? We need to explore different hybrid architectures, different integration strategies, and different learning algorithms. We also need to develop formal methods for verifying the correctness and consistency of neuro-symbolic systems. We need guarantees that these systems are not going to make illogical inferences or dangerous recommendations.
I think we need to focus on spatiotemporal reasoning. How can we develop AI models that can understand and reason about the evolution of diseases over time, the spatial relationships between anatomical structures, and the interactions between different physiological systems? I suspect the core algorithm needs to be able to translate between different coordinate representations. We need to move beyond brute force deep learning and develop algorithms that can truly understand the underlying dynamics of the human body.
And I think we need to be more critical of the current deep learning paradigm. While it has achieved impressive results in some areas, it's clear that it has limitations, especially when it comes to complex reasoning tasks. We need to be willing to explore alternative approaches, even if they seem less promising at first glance. The future of AI may lie in a more holistic, neuroscientifically grounded approach that combines the strengths of different paradigms.
I agree that we need to be open to new ideas, but I also think we shouldn't dismiss the potential of deep learning. It's a powerful tool, and it's constantly evolving. With better data, better architectures, and better training techniques, I believe we can overcome many of the limitations we've discussed today. Maybe AGI is closer than we think.
I'm more skeptical. I think deep learning is reaching its limits. We need a more fundamental breakthrough, a new way of thinking about intelligence. I'm hoping that neuro-symbolic approaches can provide that breakthrough.
I think AGI is achievable, but it's going to require a different kind of algorithm than what we're currently using. We need to move beyond pattern recognition and develop systems that can truly understand the world around them, that can reason, plan, and adapt. Spatiotemporal reasoning is the key, in my opinion.
Well, this has been a fascinating discussion. It's clear that there's a lot of work to be done to address the problem of inflexible reasoning in medical QA, but I'm optimistic that we can make progress. By combining insights from neuroscience, computer science, and medicine, we can potentially create AI systems that are more intelligent, more robust, and more trustworthy.
Yeah, it's a challenging problem, but it's also an incredibly important one. The potential benefits of AI in healthcare are enormous. We just need to make sure we're building these systems responsibly and ethically.
Agreed. We need to be mindful of the limitations of these systems and avoid over-relying on them. Human doctors should always be in the loop, and we need to ensure that AI is used to augment, not replace, human expertise.
And we need to be transparent about how these systems work. People need to understand how AI is making decisions so they can trust it. Explainability is crucial.
Absolutely. Transparency and trust are essential. Thank you all for your insightful contributions to this conversation. And thank you to our listeners for joining us on Cognitive Spirals. Until next time, keep exploring.